So as a recap today, we are going to be talking about Cool3, our proprietary Cool sculpting combination treatment, and the new Cool sculpting pricing. We're going to talk about laser hair removal, which I feel like doesn't get enough exposure, but we do laser hair removal all day, every day in our office. Vein treatments, which also you may not see it as much, but we do a ton of vein treatments. We have some cool videos to show you. And then, of course, liposculpture, just so you kind of know what else is an alternative if the CoolSculpting or Cool3 is not enough for you. And make sure to stay to the end to hear the promotions. So before I hand this over to our doctors, I just want to introduce you to the practice and the team. So we are so proud to have such a large group of amazing dermatologists and support team at Cosmetic Laser Dermatology. This is our newest photo. And everyone at CL Derm can do the treatments that we're speaking about today. So although Dr. Goldman and Leysin are speaking about them, of course, any of the doctors or anyone that you see up on the screen can do them, except for our amazing Farzaneh on your right, I think. She's our esthetician. All right, so Dr. Goldman, if you are not familiar with him, he is our founder and medical director, and he's definitely recognized globally as a world-renowned cosmetic dermatologist. Actually, Newsweek magazine ranked him the #1 cosmetic dermatologist in the whole country. And no, we didn't pay for that. We didn't even know it was happening until it came out. It was we were very proud. Pioneers a lot in lasers, injectables, and vein treatments. So although today he's talking about lipo and veins, he of course does all sorts of lasers and injectables. He's authored so many medical textbooks and articles. He's involved with the FDA approvals for lots of treatments. He was the former president of the Vein Society, and overall, he's bringing 40 years of experience. And second, we are very excited to introduce you to Leysin. And if you don't know Leysin, she is our amazing physician associate. And Leysin, how long have you been working with CL Derm?
17 years this month, actually.
Amazing. So Leysin has been here a very long time. Of course, she is the official master cool sculpting specialist. There are only two in San Diego. I guess I need to change this to 17 years of experience in a few days. But mostly Leysin she's definitely our cool sculpting master, cool tone, but she also does a lot of the light laser treatments, that we're going to talk about today, like laser hair removal and a lot of the skin tightening treatments. So without further ado, I am excited to hand it off to Leysin to share Cool3.
All right. Good evening, everyone. Thank you for joining us. We have some exciting things to cover, and I'm going to start with Cool3, which is our proprietary treatment here at Cosmetic Laser Dermatology. It consists of the CoolSculpting Elite, which is the latest technology for cool sculpting, or third generation. The Zimmer Z-Wave, which is an acoustic wave device that we choose to use during our treatments, and then the Cool Tone, which is a muscle stimulation device to build muscle. So it all started by a couple Harvard University scientists when they discovered that children that were sucking on popsicles started noticing atrophy in their cheeks. And they decided to take that and run with it. And here we have CoolSculpting. CoolSculpting is currently the only FDA-approved device that uses controlled cooling to freeze our fat cells to death, and then our body permanently eliminates those fat cells through the lymphatic system over the course of time. So many of us have stubborn pockets of fat that no matter how much we diet or exercise, we just can't seem to get rid of it. Those are great areas for CoolSculpting. Currently, there's 9 FDA-approved areas for CoolSculpting. We've got under the chin, we've got the abdomen, the flanks, the inner and outer thighs, the bra, the banana roll, which is the area right underneath the buttock, and really any area that has a stubborn pocket of fat, we can most likely CoolSculpt. So again, our Cool3 consists of the CoolSculpting Elite, the third generation CoolSculpting device. We use the Z-Wave, which is an acoustic wave device or sound wave to break those stubborn pockets of fat up. And then we like to build the muscle with the Cool Tone, all on the same day. So your personalized treatment plan consists of a consultation where we ask you to come in, we consult with you. assess the areas of interest that you might be interested in, and then we come up with a customized treatment plan for each one of you for the areas that you're interested in treating. On your treatment visit, it's a simple treatment. We've got 2 CoolSculpting Elite systems. We draw the tissue into the applicator. You'll feel 3 to 5 minutes of cold, and then the area goes numb for the remaining portion of the treatment. Very comfortable procedure. We remove that applicator. We do a brief 2-minute massage with our Z-Wave or acoustic wave device, and then we will rehook up the second area if necessary. Since we do have 2 devices in our practice, we can really treat you in a short period of time to minimize any disruption in your normal lifestyle. We have you come back a month later. We will perform the second treatment, assess your improvement, because you will see improvement as soon as 6 weeks after treatment. Some patients with the new CoolSculpting Elite notice improvement as soon as 1 month out. Continued improvement will happen over the course of 3 months. And as mentioned, very minimal disruption in your normal life. You'll have some soreness for about a week and then a little bit of temporary numbness for a few weeks. Otherwise, there's nothing you cannot do. You can return to normal life. So here's a few of my before and after photos. This patient had their abdomen and flanks treated. The abdomen here. Abdomen and flanks here after 2 treatments. This is the back, which is a beautiful area to treat that a lot of patients really appreciate. Abdomen here again after 1 treatment. This gentleman had our Cool3, so he had CoolSculpting, the Cool Tone, and the Z-Wave. So you can see he had a nice reduction in the abdominal tissue and then building in the muscles. The flanks after 2 months, 2 treatments. And then again, the back after 1 treatment. The abdomen after 1 treatment. The abdomen here again. The abdomen here after 1. Abdomen and flanks here after 2 treatments. And this patient enjoyed her results on her back. She had 2 treatments. She even decided to get some extra tattoos.
Which we can actually take off if she doesn't like them.
Right. And then here another abdomen. 2 treatments to the abdomen and flanks. After 3 treatments. The arms are a wonderful area that are hyper responsive. They typically respond very well even after a single treatment. And this is the outer thigh. So you can see the outer thigh. She had really nice improvement after 2 treatments, right in the outside area. And this was outer thigh and banana roll. And then the segmental area, the chin. We did launch some new pricing. So for those of you that are familiar or have had a consult with CoolSculpting, we are not emphasizing the price per cup anymore. We are focusing on results and treatment areas. So when you come in for a consultation, I'll assess you for 2 to 3 sessions. We'll quote you based on the areas that we're treating and the volume that we're assessing. So the price point has significantly changed. We are very fortunate to be invited to be part of this pilot program with Allergan. So I welcome everyone to come in for a consultation, and we can, again, get you to your result and not count cups anymore or cycles.
So to be really clear, it's way less expensive than it used to be.
We do have different Care Credit and Alpheon financing available to make it very affordable to pay off over time.
And this, the Care Credit and Alpheon is also applies to almost any procedure that you do in our office. So what I'd like to do, so CoolSculpting is really great. I actually even had it one time for my love handles, and it's true. It's not painful. You could read a book while you're doing it. A really interesting procedure because it feels like your fat is going numb and then it disappears. So, and Leysin is the absolute best. So So what I want to do is talk a little bit about leg veins, and people have maybe heard of this word called sclerotherapy. It basically is just injecting a medicine into the veins that make them go away. Well, it goes back basically to the 1980s is when it started to become popular, and it's about the sixth most popular procedure to do these days. The most important thing that I have found with leg veins is it's not just you see a vein and you inject it. There's actually, it's a medical condition. The veins are all interconnected with each other, and you have to be able to use the right treatment for the right vein. And so often, almost every day, I see patients that come in that have been treated by these vein clinics where they basically are trying to treat patients like dozens of times. And it's because they're not doing it logically. They're trying to do it just little piece by piece. But when we do your leg veins, it's done, I believe, more scientifically with a better result. I like to show this picture from Ansel Adams because as you see here, varicose veins would be like you have these little leaves that are blocking this beautiful sunset. And so instead of just sort of cutting off a little leaf, you have to go to the trunk and get this whole area to go away because if you just cut the leaves, they keep growing back, and that's what leg veins do. But if you cut it down at the source, you basically eliminate that source and it becomes a very quick, simple procedure. Another way to look at it is what we call this lateral venous system. So you can see that patients will come here very commonly with these blood vessels called telangiectasias on the lateral aspect of the thigh. And if your computers are pretty good and you're looking at this, you can see I'm outlining this blue vein. This is actually has a name. It's called the lateral subdermal plexus vein. And this vein feeds into all of this. So instead of sticking you 100 times and injecting all of these veins, all you need to do is inject this vein, as I'm going to show you in a video, and everything goes away. So it's doing things properly is the best way to get a great result. Now, some people have really big veins, like the size of your thumb. In the olden days, we would do something called a ligation and stripping, which is a surgical procedure done in an operating room under general anesthesia. And in fact, I was actually the only dermatologist in the United States doing that procedure about 35 years ago. But I figured out a better way to do it. Because I love lasers and because I love liposuction, I was able to do the same procedure by numbing the area up with a local anesthetic and inserting a laser fiber into the vein, causing its destruction. And that now has revolutionized the treatment of even the large varicose veins. So when patients would come in with veins that are this big, instead of having a ligation and stripping in the hospital, we could do it right in our ambulatory care center with a wide awake patient under local anesthesia. Even these kinds of veins, which you would think, oh my goodness, they're the worst in the world. This is one treatment under local anesthesia in our surgical center. Another patient, you can see these large, big veins. They go away really quickly and easily. Again, no pain, local anesthesia. And veins like this as well. So even these really big veins can go away very, very quickly and easily. So what is this sclerotherapy or injection? Again, we're injecting this medicine into the vein. The vein then develops a clot, which does not spread anywhere in your body and basically gets scarred down. So if you look at a patient before, this is what they look like one day after. It's inflamed because the medicine is causing the veins to be destroyed, and then the veins slowly go away over a period of a few months. And this is what it looks like. So this is me actually performing an injection. You can see I treated just that blue reticular vein, and all of the telangiectasias or spider veins go away. And it really is almost that simple. It truly is not a painful procedure. You can see the medicine goes along the entire course of the vein, causing its destruction. But unlike this, where you would think, oh, it goes away in a second, it doesn't. it does take a few months to go away. And that's why this time of year is a wonderful time of year to start getting treatment, because again, you have to remember it does take a few months for the veins to go away. So the way we approach veins is we eliminate those larger veins first, which your body does not need. Then we treat the smaller veins, and then finally we treat the teeniest veins. Usually it takes 1 to 2 treatment sessions per leg in order to get the veins to go away. Sometimes patients require a little bit of maintenance every 6 months to a year, but truly we can get rid of almost all of the veins with just a few simple treatments. Now, one of the things that I do and I recommend is for patients to wear compression stockings afterwards. Because if you wear the compression stockings, it basically makes the veins go away more quickly and easily. We actually did studies. So this is a real study that was published in one of our journals showing that if you just wear the stockings, the veins go away more quickly. And this is one of my wife's best friends. And she, right here, you can see she's wearing one of the compression stockings as she's riding a bicycle with my wife, who also loves riding bicycles. So for those of you driving in cars, please, you got to respect people that ride bicycles, because it could be myself or my wife or her friends. So you can do anything you want with the compression stockings. And these are some of the, now you see them, now you don't. So this is just one treatment 4 months later, one treatment 4 months later. This was actually 2 treatments 1 year later. So you can see how I showed this because you can see the healing process. So it doesn't go away immediately. It does take a few months to go away. Now, this is a really interesting patient who she came in 1988. We just treated these little, what people call spider veins. And she came back like 22 years later, and all of a sudden she developed this big vein. Interestingly, the spider vein, which was over here, was still gone, but she developed a new vein. So we treated this vein, and when I saw her 5 years later, the veins are all totally gone. So when you treat the veins, it doesn't mean you'll never get another vein in your entire life, but if you do, it usually takes 10, 20 years, and then those can be easily treated as well. Another one of my patients, 16 years afterwards, what I'm trying to share with you is once we do the treatment, it's gone for life. Just like with CoolSculpting that Leysin spoke about. Once we destroy the fat is gone. Another one of my patients 15 years later. So you can see I'm so old that my patients, I don't know how, but they keep finding me all the time. But they find me because they want to thank me or they have something else they want to do. So now I want to turn it back to Leysin to talk about laser hair removal.
All right, so laser hair removal. Is laser hair removal permanent? It's permanent reduction. So in our practice, we've got 3 different lasers that we use for laser hair removal. The laser targets pigment in the hair follicle. So as long as the hair is dark brown or black, then the laser can effectively see it to target and treat it. It does not, unfortunately, treat blonde, white, or gray. So you'll have to stick to other modalities. But that dark hair, it works fantastic. The laser is a wavelength of light that targets the pigment in the root of the hair follicle in the active growth phase. So it will actually heat up that hair in the active growth phase and damage it so that that follicle will permanently be damaged and not produce hair again. We typically treat at intervals so that the laser can target different groups of hair in the active growth phase. So it is a series of treatments, typically around 4 to 6 sessions, to obtain about 70% reduction. Again, the hair grows in different growth cycles, and we wanted the wavelength of light targets the anagen growth phase or the active growth phase. So we have you come at certain intervals so that we can get that hair in the active growth phase. Most common areas for treatment: the face, the neck, the bikini, the chest, the abdomen, the upper lip, the arms, underarms, the back, the legs, really anywhere that has dark hair. We typically, during a consultation, it's very important to have a thorough consultation. We assess your Fitzpatrick skin type to determine what laser and wavelength is going to be most effective to target and treat that hair, and review certain things for preparation for treatment. Best time of year to do laser hair removal is now, because we do not like to treat you with an active suntan. So I would get started. A lot of patients will say, if I start now and get tan, can I not do it? You can start, you can take a break and still achieve those great results, and then pick it right back up after a vacation or a summer if you plan to be out in the sun more than you should be. We do like you to come in with a clean shave the night before treatment, and to avoid any waxing or plucking or depilatories for a month before, so that the laser has something to target and treat. Aftercare, the technology has come such a long way in the 20 years that I've been doing laser hair removal that really it's virtually painless, and there is no irritation after treatment, and it's very quick. So we can treat a full back in 20 minutes. It used to be that it would take hours to hour and a half. It used to be quite uncomfortable, numbing cream needed. It's not the case anymore. So we have the newest technology that is fantastic.
So just for interest, I was one of the very first people ever to have my back treated with laser hair removal, because we developed the lasers for it, and it was a little spicy, but now it's way, way better.
So here's some before and after photos. This is a great area to treat. See, the irritation that this patient had in the before photo is essentially gone after the treatments. So anywhere you have razor bumps, irritation, ingrown hairs, you'll notice improvement in that almost immediately within a couple treatments.
Yeah, we treat a lot of Marines and military who have to be clean shaven. And as you can see in the pre-picture, they get what's called a pseudofolliculitis, which is like ingrown hairs. And this is actually, mind blowing. You can totally get rid of these ingrown hairs forever in these people.
And it's nice to see that the follicles, the black follicles are improved in the after photo. So the skin is smoother. The appearance of the skin looks nicer. I have a lot of patients that come in just for that, even on the legs, to get rid of the black follicles.
Yeah, it turns out that when you do laser hair removal and you're destroying the hair follicles, it also stimulates a cell in the skin called a fibroblast that makes more collagen and elastic fibers and hyaluronic acid. So even though you're going in to get your hair removed, it actually also helps with wrinkling, fine lines and wrinkling too.
So after 5 treatments here, this patient had 3 treatments, nice reduction. Same patient here.
Okay, so that was great. One of the things I wanted to mention with the laser hair removal is when we see patients that don't have a good response, it's invariably because they're taking something like testosterone, or they're using a testosterone cream. So sometimes we'll get patients, we'll have them clear, and then all of a sudden some of the hair starts growing back, and usually it's because of testosterone. So that's just a little thing I wanted to throw out there. So liposuction, or liposculpture as we like to call it, has been around for about 30, 35 years. And in our office, I was actually fortunate to be one of the first people trained in doing liposculpture by Dr. Jeffrey Klein, who was the inventor of it in San Juan Capistrano. And liposculpture is really not liposuction that you would see like on TV, where people are using almost a vacuum cleaner to suck out your fat with these really big devices under general anesthesia. Our patients are fully awake. They feel absolutely no pain whatsoever. And the size of the cannulas we're removing it is like pencil lead. So it's so much smaller. It's so small, we never have to suture or sew up the insert sites. So it's just like a needle, but it's a larger needle, and it's totally painless. And so it's done under local anesthesia. We're listening to music. One time I had a patient singing opera to practice. So it's not a horrible procedure. It's not like what you see in the movies. You do get a little mild swelling and bruising afterwards, like with any kind of procedure. You wear a compression garment for just a few days. When I had my liposuction done on my abdomen, basically I did a 40-mile bike ride the next day. And so it's not something that's going to make you lie in bed like a truck ran over you. The way we like to do liposculpture, it's a very simple procedure. Not as simple as CoolSculpting. That's the simplest procedure, but liposculpture is another way of totally destroying the fat cells. And these are some of our patients. And again, all of the doctors in my office, we all do this procedure. And you can see it works very well under the chin. So almost like the same pictures Leysin was showing us for CoolSculpting, we can show you with liposculpture. The only difference is with CoolSculpting, it can be 2 or 3 treatments, separate treatments to get the same result that we can accomplish in one liposuction treatment. And again, the arms are another good place. So it's really a nice treatment to have done. So to recap, besides Risa welcoming all of you, we spoke about this new Cool3 that we have a proprietary way of advancing and accelerating the treatment with CoolSculpting. We spoke about laser hair removal. And one thing is we've been trying to get those blonde and gray hairs, but the company we were working with went bankrupt. Not our fault. So, but I think in our lifetime, we still will develop a way to get the blonde hairs because we were so close until the company went belly up. And then veins are a great thing to have removed, especially now before the summer, and then liposculpture. So what Risa wanted to make sure we did is allow enough time for questions, because I think that the last time we did this, we had the great questions from all you guys. So I'm going to turn it back to Risa, who's going to guide us through questions and answers.
Thank you so much, Dr. Goldman and Leysin. That was great. Somehow you covered it all. That was amazing. All right, guys, before I take this slide down, I just want to remind you all that there is a promotion. So after today's webinar, I have recorded everyone that is here and that stayed through. And 3 of you, the first 3 of you to book a consult and to book your treatment will get 10% off the whole treatment, plus a really fantastic skincare basket at the completion of your treatment. So make sure to mention this webinar. All right, I will remove that screen. So now, guys, it is time for live question and answer. So feel free to ask your questions and we'll get to as many as we can. All right, here is the first question. Can all of these treatments can any of these treatments or all of them be done with someone with dark skin?
Yes. You know, one of the things in people with darker skin is many of our treatments, especially with our lasers, need to penetrate through the skin before they act on the hair follicle or the fat cell. But the CoolSculpting and liposuction doesn't matter what color or shape your skin is in. The laser hair removal with our new advanced lasers are perfectly fine for people of any skin color. And then leg vein treatments also. Some people had said and told me, oh, I don't want to do my leg veins because it's going to make them turn black or darker in a dark skinned person. And that's not true. If you're doing it correctly by treating those feeder veins first and treating the whole venous system, all like one leg in one treatment, I very rarely, if ever, see a problem with darkening. So all of these procedures, it could care less what age, skin color, ethnicity, you can be anything and we can treat you.
Yeah, and I think that's one of the most important things to remember is those theories are out there because most practices only have 1 or 2 lasers. Only because cosmetic laser dermatology has more than 60 do we have a specific hair removal laser that's specifically ideal for dark skin and so forth. So, all right. Oh, here's a great question. Can you treat veins on hands? Ooh, guys, here, look, I have some too.
Yeah, so the answer is yes. I do this maybe once every few weeks. the hand veins, the only problem with hand veins is you can't put a compression stocking on it. And so I find that the hand veins become sort of harder and takes about 2 months. So before patients start bringing us cookies and snacks and stuff like that, it's about 2 months. So during that 2 month period, it's not painful at all. It's just the veins look a little darker and they actually feel hard. And interestingly, the word sclerotherapy, sclero is the Greek for hardening. So it's just the vein being destroyed and then your body resorbing the vein, taking it back. So hand veins, easy to treat, but it's going to be maybe 2 months before you're going to see a phenomenal result.
That's really helpful. I think a lot of people don't realize you can do sclerotherapy on the veins. But if you don't want to remove the veins, don't we have another procedure that can kind of cover them up?
Well, yes, that was really smart, Risa, because some people have these really prominent veins that you have to treat. But most often, when I see these big veins on the hand, it's in more elderly patients with thinner skin. And as the skin becomes thinner, the veins will sort of pop out and rise to the surface. And so we use a medicine called radius. And I was actually the national head of the studies that got the FDA approval for radius before the FDA, where we inject the radius into the hand and that thickens the skin up so that it hides not only the veins, but also the tendons. And so that's something that we do as well.
Yeah. Right? We're all looking at our hands right now, guys. So if you look down at your hands and they don't look like your little kid's hands, Dr. Goldman and Leysin can help. All right. Oh, here's one more question about hand veins. If you lift weights, will those hand veins probably come back?
It's really interesting. I've been doing sclerotherapy for hand veins for probably 30 years, and I've never seen them come back, ever. So the real question is, where the heck does the blood flow? Because, blood should be flowing in veins. What happens is when we get rid of these superficial veins on the skin surface, it flows in the intramuscular veins inside. And so you still get that blood flow. It's just we're sort of tricking the body to getting rid of the veins on the surface and sending the blood deeper. It's the same thing with leg veins. A number of patients will say, well, why are you treating these leg veins? Won't I need it like if I need a coronary artery bypass graft? And the answer is no, you don't put varicose veins into your heart or it explodes and you die. And so the other thing is, well, how's the blood going to get back to my body? And the answer is only 4 to 5% of blood flow is in the superficial veins on the skin surface. 96% is underneath in the muscular veins. So there's no problem whatsoever in getting rid of those veins.
That makes a lot of sense. And I know today we talked about sclerotherapy for leg veins, but if someone has really bad leg veins, do we offer anything kind of more aggressive?
Yes, we also, I spent just a few minutes talking about, we call it EVLT or endoluminal laser closure. And that's a procedure I actually helped invent where we insert a laser fiber into the vein under local anesthetic, wide awake patient, and we seal the vein closed. And that now, I developed it in 1999, and that now has replaced. So no vascular surgeon, for instance, does stripping anymore, ligation and strippings. They all do this procedure developed by a dermatologist. That took a while to convince them that I knew what I was talking about, but now that's the number one procedure that vascular surgeons do for veins.
All right, so here's a good question. So we talked a lot about CoolSculpting today and lipo. How big of a difference how better are the results with lipo, or can you get good results with CoolSculpting too?
So I actually can assess all patients. I know when to refer. If there is a large amount of volume that I just feel won't respond to CoolSculpting to get you your optimal result, I will refer to the physicians. As Dr. Goldman had mentioned, with liposculpture, you can remove more volume with one treatment as opposed to CoolSculpting. So CoolSculpting, it is multiple treatments, a minimum of 2, maybe 3 sessions, depending on the area and the amount of volume that's there.
Yeah, another way to put it is if you have a lot of fat and you're not taking Ozempic or one of those other drugs, what we can do is we can literally remove 5 to 10 pounds of fat in a liposculpture procedure. CoolSculpting, it's like in the half-pound range. To put it in some kind of, to make it, to try to explain it a little bit better. But both of those procedures work best in patients that are at a pretty good weight. It's not like they're really obese or anything. And they just have like little areas like love handles. Or for instance, yesterday we just did this guy's breasts because some men will have a lot of breast fat. And this guy was in his 30s, very handsome, very muscular, but he had little fat in his breasts, and we were able to suck that out in about an hour or so. Interesting, with CoolSculpting, we can do that as well, but it's a little more painful for some reason with the CoolSculpting. So that's just one example. Or with me, my love handles. I'm a cyclist. I'm not in that bad of a shape, even though I'm almost 70. But, I couldn't get rid of these stupid love handles. So I did liposuction with Dr. Klein, and then Leysin did CoolSculpting on me to make it even more perfect. And then, as Leysin was saying, the chin, this is a great area to do with CoolSculpting. Yes, we can do it with liposuction too. What I would do is I would only do liposuction if there was a lot of skin laxity as well, because we can tighten the skin a little bit better. But CoolSculpting also tightens the skin. So what we try to do is we try to figure out what's going to be best for the patient. As far as prices, they're a little comparable. I think the liposculpture maybe costs a little bit more than the CoolSculpting, but not significantly more. But we try to choose what we think is going to work best for the patient, one, and two, what fits the patient's lifestyle. And preconceived notions. Some patients just can't get it out of their mind, sucking fat out with a suction, machine, and they can't get that out of their mind because they saw it in Hollywood and like Fight Club or one of those silly movies. And so, sure, we've got CoolSculpting as well. Other patients, they said, look, I just want to come in one time. I want to get all this done all at once. I don't want to come back 2 or 3 times. Then we do the liposuction. So, it's based on what our patients would like to do, and our job, Leysin and mine, and all of our doctors, our job is to try to explain the pluses and minuses of everything, and then give you the opportunity that you can choose what you believe will be best for your body and your lifestyle.
Yeah, I love that. And I think that's why so many people choose cosmetic laser dermatology, because since we offer both the surgical and the non-surgical, you don't need to pick. You can come in and we can assess you and speak specifically about both options and help you decide. Whereas most practices would only offer one or the other, so they're obviously going to be pushing you in one direction. All right, here's a great question about this submental area you were just pointing to. So I have sagging in the submental and jawline area. When I lose weight, it gets worse. And when I gain weight, it improves a little bit. So I'm wondering, will lipo make the sagging worse? And is there a way to treat that sagging skin without lipo, or what are my options?
Yeah, that's a great question, and truly, it would be wonderful if we could actually physically see you to explain it more completely. But usually, when you have a lot of lax skin in this area, with or without fat, there's 2 ways to go. One is surgery, a facelift, and sometimes a plastic surgeon will say, no, it's a neck lift or a lower face, but it's a facelift. And facelifts have, even if you go to the best plastic surgeon in the world, there's scars and it's expensive, XYZ. But what we do is we have a different procedure, which we call ThermiTite. So it's where we're using liposuction if there is fat, And then we have a special probe about the size of a Q-tip that we put under the skin that heats the skin and contracts it. And so we do that as well. But sometimes if it's really lax, we do have to recommend a neck lift or lower facelift. So it's not like we can do everything. If you really need a plastic surgeon to do a neck lift, we're going to refer you there as well.
Great. And I will post a link to the webinar on ThermiSculpt in here for everyone to see it. There is. All right. Does anyone else have any final questions that you might want to ask? This is your opportunity with Dr. Goldman and Leysin. Okay, here is a good time. So how much time does it really take to see results? Do I really need to come in now for summer?
It depends on what you're treating.
Yes, with CoolSculpting, it takes usually around six weeks to 3 months to see improvement. So I would say yes, the sooner the better for CoolSculpting. And same with laser hair removal. You want to get started so you can kind of see it's about a 10 to 15% reduction with each treatment. And of course, it'll be a series of around 4 to 6.
Yeah. With liposculpture, usually you'll see the results within a week or so, but you get that final result in about a month or so. And then with veins, as I said before, it's not as magical as that video showed. Before you're going to be so happy and bring us presents and everything, it's 6 to 8 weeks.
All right. So let's see how, Leysin, what does it look like if someone wants to come in to have this consultation with you to see if they're a candidate for treatment? What will it look like? And I'm going to post a link so you guys can all book online to see Leysin.
For CoolSculpting or for laser hair removal?
I guess for CoolSculpting.
Yeah, for CoolSculpting, we schedule a 30-minute consultation, and we just review again the procedure and assess the areas of interest and come up with a treatment plan, a customized treatment plan for each individual. Of course, you'll receive a quote that day, and then we'll discuss what it looks like for how long the procedure will take. And then we can look at scheduling. So it's usually you can get in with that within a couple weeks. And that's pretty much what to expect with a CoolSculpting consult.
It's all really easy.
Yeah.
It's just the time to drive here, park, and come in.
But best of all, you guys, the best kept secret is Leysin offers complimentary consultation. So she can tell everyone else, but I just posted the link. And before we remove complimentary consultations, I really highly recommend you get in because Leysin has so much knowledge to offer in all these, but she's worked alongside Dr. Goldman and all the doctors for so long. She's going to be a good resource for whatever you need. Okay, a few more questions. So for lipos,
she treats me and my family too.
Yes, and me. All right, so for liposculpture, can I come in by myself?
Sure, you can bring your friends if you like, or your partner. But yeah,
I think they may mean after the procedure. Can they?
Okay.
Maybe.
So can you drive yourself to the operating room and drive home? And the answer is yes. So if we're doing smaller areas, like let's say the arms or the neck, those are smaller areas. We don't have to use any anesthetics, any general kind of anesthetics at all. When we're doing large areas, like a large abdomen, for instance, there we offer you twilight sedation, sort of what you have if anyone has had a colonoscopy or something like that, where the doctor gives you some medication and then you wake up and you go, did you do it yet? One of those kind of things. So we have triple AHC accredited operating rooms, 3 of them, and right here in our facility with physician assistants, registered nurses, doctors, the whole 9 yards. So we're able to do everything right here in our facility. And so for patients that we are going to recommend intravenous sedation, just like when you would have your colonoscopy or something else along those lines, we do require someone to take you home, or we can arrange transportation. We have one of our not employees, but we use a service that does transportation to and from the office as well.
Yeah, for a lot of our patients, because we have so many coming in from out of town. So we can definitely help, but you are welcome to drive yourself too for a lot of the treatments. And for pain management, I just also want to mention that we have this great thing called Pronox. I know I personally have used it. I am a wuss and I was so afraid of pain, and they give you a little bit of this. It's kind of like laughing gas, and you don't even think about it.
Yeah, it actually is laughing gas,
It is.
nitrous oxide, but it's an incredibly safe way to administer it. And actually, we just finished a little clinical study. We actually showed that people that do nitrous oxide just feel better. It does something to make you actually feel better too. So even though it takes the edge off and the pain off, when you go out, it's almost like you had a vacation or something. So
that
that's
sounds
a new
lovely.
study that we just finished.
I can't wait to see it. So here's a good question. Can ThermiTite be done without liposuction? Maybe if I don't need liposuction for the submental area and gels.
No, absolutely. And we've even do ThermiTite on the arms when people have very loose skin in the arms or above the knees. We can also use that treatment. But we have other treatments that Leysin is an expert in, Thermage, Soft Wave, and Ulthera. So we have a number of different ways that help to tighten the skin. So the doctors do the ThermiTite procedure. Leysin does the Thermage, Ulthera, and CoolSculpting, and I'm sorry, and Soft Wave procedures.
Yeah. And we're so lucky to have all three of those devices, you guys. It's amazing. All right, so if no one else has any final questions, we can wrap up a little bit early. I'm so grateful for Dr. Goldman and Leysin to spend time with us today after your busy schedule. And for all of you that tuned in, I know you all had really busy days too, and thank you for carving out a little bit of time for us. We hope you found this educational and useful, and we hope that you can come in and get scheduled with Leysin to be one of those three for the promotion for this webinar. Because if you've been a patient or if you know a lot about our practice, you know we do not really offer promotions. So this is a good opportunity. So any final words, Leysin or Dr. Goldman?
No, it's always fun to do this. Thank you so much, Risa, for hosting.
Thank you very much. Yep,
Great.
We look forward to seeing you.
Someone just asked more about Thermage Soft Wave therapy. So you know what? Can we answer them really fast? Just kind of a little bit more about those?
Yeah, they're three really good machines and technologies. They all do something similar. They're part of what we are calling rejuvenative medicine. They help to rejuvenate a cell in our body called a fibroblast, and that's the cell that makes collagen and elastic fibers and the ground substance of skin called hyaluronic acid. And so all three of those technologies stimulate those fibroblasts to become like 10 years younger or 20 years younger and start churning out those real healthy young collagen and elastic fibers again. And what they also help to do is to tighten the collagen that's already there. So all three of them work really, really well. We sort of choose the right one for the right body part and the right thinness of your skin. So that's why we have all three of those technologies, because you know what they say, if you have a hammer, everything looks like a nail. So it's like we have to have the right tool for the right job, and that's why we have all three of those different technologies. That Leysin is one of the national experts with all of them, and she does all of those procedures for us.
Beautiful. All right, guys. Well, I hope we answered all of your questions. Thank you so much for your time. Thank you, everyone, for tuning in. And please make sure you schedule with Leysin and tell her you saw the webinar. And we hope to see you all soon. So thanks, everyone. Have a good night.
Bye-bye.
Bye.